week's Beyond Clean Expert Series episode entitled Putting the Puzzle Together for Point-of-Use Pre-Cleaning Compliance, Part 1, was written by enzymatic expert Peggy Spitzer, Clinical Education Manager at Sterile International. The drumbeat for starting instrument processing at point of use continues. It takes a team with perioperative management, infection preventionists, and SPD leadership to keep pressing for compliance after the latest survey visit. Compliance involves two important steps. 1. Pre-cleaning with sterile water and sterile sponges during procedures, and 2. Pre-treatment with wet towels or chemical sprays to prevent residual soils from drying during transport. The first puzzle piece is education to motivate teams at point of use in surgical, labor and delivery, endoscopy, and other critical departments with heavy soil loads. Clinical teams need to understand how dried soils lead to biofilm, corrosion, and instrument damage. Another puzzle piece is making compliance as easy as possible. For example, non-saline sterile water should be readily available, with a method to collect soiled sponges and excess liquid. Contaminated items should not be transported in any type of liquid bath. A third critical puzzle piece is transit time from point of use to central sterile processing. If always under 1 hour, covering contaminated instruments with wet towels may be sufficient as a moisturizing method. Delays are much more common due to overnight procedures, such as labor and delivery, processing log jams in SPD, transport from off-site clinics, and personnel shortages to transport or process instruments. Delays in transit may create the need for effective pretreatment chemical agents. Part 2 of this expert series will cover how to select and implement pretreatment spray chemical agents. Thanks for listening to this episode of the Beyond Clean Expert Series. For more chemical questions and answers, you can contact Peggy at pspitzer@sertol.com.